Here is a video that'll help you understand the anatomical position and terminology in gross anatomy. Topic: Anatomical position and terminology. Gross anatomy relies on a standardized language and reference position so that structures of the human body can be described clearly, accurately, and without ambiguity. This standardization is achieved through the anatomical position and a set of anatomical terms that describe location, direction, planes, movements, and relationships between body parts. 1. Anatomical position definition. The anatomical position is the universally accepted reference position of the human body used by anatomists, clinicians, and health professionals when describing the location of body structures. Description of the anatomical position. In the anatomical position, the body is standing upright and erect, facing forward, head level, eyes looking straight ahead, upper limbs hanging freely by the sides, palms facing forward, supinated, lower limbs together or slightly apart, feet flat on the floor and pointing forward. Importance of the anatomical position provides a constant reference point, regardless of the actual posture of the body, prevents confusion when describing anatomical relationships, ensures uniform communication among healthcare professionals worldwide. All anatomical descriptions, anterior, posterior, medial, lateral, etc., are made as if the body is in this position, even if the patient is lying down or inverted. 2. Anatomical terminology. Anatomical terminology consists of standardized words used to describe location, direction, planes, movements, and body regions. 3. Terms of direction and position. These terms describe the location of one structure relative to another. A. Superior and inferior. Superior, cranial, toward the head or upper part of the body. Inferior, caudal, toward the feet or lower part of the body. Example: the heart is superior to the stomach. B. Anterior and posterior. Anterior, ventral, toward the front of the body. Posterior, dorsal, toward the back of the body. Example: the sternum is anterior to the heart. C. Medial and lateral. Medial, toward the midline of the body. Lateral, away from the midline. Example: the nose is medial to the eyes. D. Proximal and distal. Proximal, nearer to the trunk or point of attachment. Distal, farther from the trunk or point of attachment. Example: the elbow is proximal to the wrist. E. Superficial and deep. Superficial, closer to the surface of the body. Deep, farther away from the surface. Example: the skin is superficial to the muscles. F. Internal and external. Internal, inside an organ or cavity. External, outside an organ or cavity. 4. Anatomical planes, EA. Sagittal plane, divides the body into right and left halves. Median, mid-sagittal plane, divides the body into equal right and left halves. Parasagittal plane, divides the body into unequal halves. B. Coronal, frontal plane, divides the body into anterior, front and posterior, back parts. C. Transverse, horizontal plane, divides the body into superior, upper and inferior, lower parts. D. Oblique plane, divides the body at an angle not parallel to the standard planes. 5. Terms related to body movements. A. Flexion and extension. Flexion, decreases the angle between two parts. Extension, increases the angle. Example: bending the elbow is flexion. B. Abduction and adduction. Abduction, movement away from the midline. Adduction, movement toward the midline. Example: raising the arm sideways is abduction. C. Rotation, medial, internal rotation, movement toward the midline. Lateral, external rotation, movement away from the midline. D. Circumduction. Circular, movement combining flexion, extension, abduction and adduction. Pronation and supination. Pronation, palm faces posteriorly, downward. Supination, palm faces anteriorly, upward. F. Dorsiflexion and plantarflexion. Dorsiflexion, toes move toward the shin. Plantarflexion, toes point downward. G. Inversion and eversion. Inversion, sole of the foot turns medially. Eversion, sole of the foot turns laterally. 6. Terms of relationship and comparison. Bilateral, present on both sides of the body. Unilateral, present on one side only. Ipsilateral, on the same side of the body. contralateral, on opposite sides of the body. 7. Anatomical regions and body divisions. A. Axial and appendicular parts. Axial part, head, neck, and trunk. Appendicular part, upper and lower limbs. B. Body cavities, dorsal cavity, cranial and vertebral cavities, ventral cavity, thoracic and abdominopelvic cavities. 8. Clinical importance of anatomical terminology. Essential for accurate diagnosis and treatment, used in surgery, radiology, and physical examination, helps avoid medical errors, forms the foundation for all branches of anatomy and clinical medicine. In conclusion, the anatomical position and anatomical terminology form the language of gross anatomy. They provide a standardized system that allows precise description of the human body's structures and their relationships. Mastery of these concepts is fundamental for students of anatomy and indispensable for healthcare professionals.